Hello, I'm here to teach you a little bit about attention deficit hyperactivity disorder, or ADHD, a disorder that is, in my opinion, very misunderstood. I say that because so many are quick to judge when they see a child acting out for no apparent reason, or they see an overactive child in the store and think, why can't that lady just control her kid? Honestly, I have thought that myself. Let's take a closer look at the disorder and perhaps it will change some common misconceptions. The objective of my presentation is to share information about ADHD, for example, what causes it and how it is treated, to raise awareness of the disorder and the effects that it can have on families. Finally, I will share the positive attributes of ADHD and what community and family support can do to help those who have this disorder to succeed. What is ADHD? ADHD is the most common brain disorder that is diagnosed in children. It affects the brain's impact on behavior, which in turn can affect academic achievements and social and cognitive well-being. ADHD is a disorder of the neurotransmitters called catecholamines. In 2018, it was estimated that approximately 7.2% of children were affected by ADHD. That was 6 years ago. I believe today that percentage is higher. A little history on ADHD. In the 1930s and 1940s, restlessness and inattentiveness were associated with minimal brain dysfunction, or MBD, due to frontal lobe trauma. That theory was debunked for lack of support of evidence. Later, there was a debate regarding two separate disorders in which some children displayed inattentiveness while others displayed hyperactive and impulsive symptoms. This led to the diagnosis labeled attention deficit disorder, or ADD, with two subtypes, ADD with hyperactivity and ADD without hyperactivity. After much more debate and unsupported studies, the American Psychiatric Association put ADHD into a category of its own with three presentations. Number one, primarily inattentive. Number two, primarily hyperactive impulse. And number three, combined presentation. There are several possible symptoms for each of these, but I'm going to just share a few. With primarily inattentive presentation, a few of the symptoms are not being detail-oriented, appearing to not listen, being distracted by others and things around them, lack of follow-through on assignments and tasks, and being forgetful and disorganized. With primarily hyperactive impulse presentation, a few of the symptoms include being fidgety, constantly moving, trouble staying in one place, trouble with taking turns, blurting out answers to questions, and being impulsive. Combined presentation would include a combination of all symptoms from each of the first two presentations. Youth up to the age of 17 would need to meet 6 symptoms from each of those full lists, and youth 17 and above would need to meet 5 from each list. So what causes ADHD? Genetics appear to be the biggest risk factor for ADHD. The likelihood that a child with ADHD has a parent with the disorder is about 50%. Studies show a high probability of polygenics contributing to ADHD, meaning that there are 2 or more genes involved. Much research has been done regarding whether there are environmental factors associated with ADHD as well. First, that being fetal exposure can pose a risk for ADHD. These exposures include smoking, infection during pregnancy, and illicit use of drugs, to name a few. Although more research needs to be done, one study even found suggests that there may be a possible risk in the use of antidepressants during pregnancy. This relation has been of some interest in recent years with the rise in use of these medications. Second, although results range from low to moderate, studies have shown that there are associations between environmental pollutions such as lead and nitrogen oxide and the risk of ADHD. The findings were not completely conclusive. However, there is some indication that environmental toxin associations with ADHD may depend on certain genetic types. Finally, there have been some studies regarding the family environment and how it relates to ADHD in children. It seems there is a slight correlation, and although family factors may not be causal, there may have be an impact on symptoms, as environment can have an effect on behavior. How does ADHD affect the family? I'm going to show you a couple of video clips, one of Sam and one of Kyle, to maybe give a little bit of insight into what family life is like when you have a child with ADHD.
Down. Hop down, please.
Okay.
Thank you.
Curiously, Sam's hyperactive because parts of her brain are actually underactive. She's constantly seeking stimulation, trying to kickstart her brain to get it into focus. A bit like revving up a motor to keep it from stalling.
The hardest thing with Sam is the energy, being on the go and not doing what she's told. Down.
And this is family life with Kyle.
Biting children or pushing them, or he'd go up, it didn't matter whether they were bigger than him or smaller, or adults even, he'd go up and bite adults behind the knees or things like that, you know, and got to the point where I couldn't take him anywhere, I couldn't go anywhere. There was just a select few people who understood what we were going through and where he was coming from, and they'd wrap their children up in woolly jumpers and things so he could go and play with them so that they wouldn't get bitten. But there would always be tears, and I would always be on his back, and it would just be a constant thing, and it had a big effect on our family. It had a big effect on our daughter, who was embarrassed to go anywhere because everybody knew her brother was trouble. Biting children.
So those videos display a little bit more extreme cases of children with ADHD and how it affects their families. As you can see, ADHD can have a huge impact on family functioning. Children with ADHD struggle with social interactions and relationships. Children with hyperactivity impulse may be described by parents, teachers, and caregivers as being difficult, demanding, and stressful to deal with. Due to impulsive behaviors, they may have a harder time getting along with their siblings, and more so than other children that don't have ADHD. Having a child with ADHD puts a financial strain on families as well. In some cases, the child may get sent home from daycare or school due to problematic behaviors, and a parent has to take leave without pay to be at home with them. The cost of getting the care for their child needs to help manage the disorder can also put a hardship on the families as well. These examples and more can be exhausting and very stressful on parents of children with ADHD. It makes sense to say that a child with ADHD has an impact on siblings too. Generally, the child with the disorder will get more attention because of their behaviors, and siblings may feel left out or neglected. About half of school-age children with the disorder have trouble socializing with peers and forming good relationships. Peers may look down on them due to impulsive behaviors. This can make it difficult for them to learn proper social functioning, and where treatment can be very beneficial. There are effective treatments for ADHD. However, it may take some time to find out what works, as each child is different. For younger children, ages 4 to 5, treatment may include evidence-based behavioral therapy that includes the parents, the teachers, and the caregivers. Children with continued moderate to severe symptoms may also benefit from medication therapy as well. For school-age children, ages 6 to 11, treatment would also include behavioral therapy with parents and teachers, as well as some social skills training, which can take place in the school, maybe gathering groups of friends together in a session. Along with that, stimulant medications may help to reduce behavioral problems. For adolescents ages 12 to 18 years old, behavior therapy treatment would include parents and teachers as well. It would benefit them and perhaps even some stimulant medications for severe symptoms. It is suggested that school and family form a partnership when working with a child with ADHD. Parent-caregiver trainings can help build parenting skills, reduce stress in the environment, as well as reduce ADHD symptoms in the child. Therapy for the whole family is a good idea to aid in success of the child and the family as a whole. I would like to share some positive outlooks. How can someone with ADHD be successful? Although there are frequent challenges related to ADHD, such as academic difficulties, relationship issues, unsuccessful treatment issues, and risky behaviors like substance use, there are positive aspects that I would like to highlight.
Hi, my name is Stephen Zanti, and I'm a director, and a writer, an actor, a drummer, scuba diver, soccer player, a camera operator, an airbrush artist, a physicist, a stargazer, a rock climber, a snowboarder, a model maker, a stage manager, a camp counselor, a PA, a DJ, a club president, a magician, and for a brief stint in May of 2012, I was called upon to repair 2 stopwatches which had stopped working. Who am I, you ask? My name is Stephen Tanti, and I have ADHD. Hi, my name.
As you can see from that video, there are many positive attributes that have been associated with ADHD. Without those, maybe he wouldn't be as successful as he is today. Some of these attributes include resiliency, creativity, and having the energy to finish something of thorough interest. I have seen firsthand how someone with ADHD gets an idea in their head and takes off running until it is complete. When a parent, all of those things, when a parent, caregiver, or teacher is confronted with having to care for or teach a child with ADHD, they should embrace the opportunity to help them grow and to succeed. For so many of these children are labeled as bad kids or troublemakers when all they really need is some encouragement and some support, such as Steve got from his family.
We need a healthier understanding of people with ADHD, and it starts at home. I had a mother and a father who supported every obsession. I distinctly recall my father asking one day, "Son, you're only 14. What could you possibly want with an air compressor?" To which I responded, "I want to airbrush t-shirts and shorts and sell them to my classmates and friends." All right then. And he would go out and he would get it, and I would play with it, and I would obsess over it. We need a healthier understanding.
So as you can see, over obsessing and being hyper-focused is definitely a strength in someone who has ADHD. I also included this little ADHD is my superpower sticker. I found this quote and it really kind of shows what strength can do, and I feel like it was necessary to include. Strength does not come from winning. Your struggle develops your strength. When you go through hardships and decide not to surrender, that is strength. And that is quoted by Gandhi. The takeaways from my presentation, in closing, I would like to add, ADHD is a complex disorder with different presentations, and the dynamics can be hard to understand. Diagnosis may be difficult as the symptoms vary case by case and can be confused with other disorders. There are many studies out there, and research is still being done on the causes of ADHD. However, it appears that genetics are the greatest risk factor. Treatment options are available and diverse. It is not a one-size-fits-all, as you can see. Sometimes children simply need behavior therapy, while others may benefit from therapy and medication. The thing I want to emphasize the most, however, is that a diagnosis of ADHD is not necessarily a bad thing. With the proper support from parents, teachers, and community, someone with ADHD can succeed beyond expectation. I feel that this disorder is very misunderstood and that people need to just take a step back sometimes and look at the situation and consider themselves in the shoes of a parent with a child that has ADHD. I would love to know what you have learned from my presentation. This is a list of the questions that I will email to you. If you wouldn't mind typing up your answers and emailing them back to me. Also, if you have any questions or comments, I would greatly appreciate you sharing. Thank you for your time and participation in this presentation.